Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be discussing wound tunneling. But first, if you could hit that subscribe button, it would be greatly appreciated as it truly helps my channel grow. So let's get started. So what is a tunneling wound? So wounds that have tunnels in them, you can actually take a probe, so a cotton tip applicator, and probe it down, and you have your wound base, and it actually goes past the wound base and it's a tunnel, okay? So they can be short, long, shallow, or deep. It can take twists and turns also. So if we do have a tunneling wound, they do need to be packed to close that wound, okay? Or it can actually form an abscess. So we want to make sure that that doesn't happen, or the wound will just reopen once we get it closed, if we get it closed. So how are tunneling wounds diagnosed? So sometimes the tunnels are very, very hard to see in a wound base. So we always want to be having a wound care specialist examine the wound base, see if they can find any tunnels, because they do have to be treated quite specifically so they don't get larger or more don't form. Okay, so always having somebody examine that wound, definitely important. So what causes a tunneling wound? So there's actually a few things that can make you more susceptible to having a tunneling wound. So a stalled wound. So this is when a wound is stuck in that inflammatory phase for too long. Okay, so that can start causing tunnels. Some other factors or comorbidities, so diabetes, rheumatoid arthritis, venous insufficiency, malnutrition. So if you're not getting the proper nutrition to heal, your wound can stay in that inflammatory phase for too long. Obesity. Some other things that make you more susceptible are infection, pressure wounds, or wound dressing. So if that wound dressing is pushing on that wound, causing pressure, or if a person is sitting on the wound and there's constant pressure, it can make the wound more susceptible of having tunnels. So how is tunneling typically treated? As I said before, normally with packing, but knowing what caused the actual wound to begin with, the tunneling to begin with, will help treat it. So packing it for sure to make sure that we're not forming an abscess, and we always want to fluff, not stuff the packing. We just want enough in there that it's not creating pressure, but it's filling that dead space to let it heal. Medications. So this might include pain medications or antibiotics. Negative pressure wound therapy. Okay, so they do use this a lot in treating tunneling wounds. There is specific packing that will go into the tunnels, and the negative pressure, so it's like a vacuum on the wound, and it does pull the wound towards the surface, allowing it to heal quicker. Sometimes surgery is needed, and then just managing pre-existing conditions, okay? So it's really treating the problem to treat the wound. So are there ways to prevent tunneling? Honestly, you can't ever totally prevent them, but there is ways to lower the risk. So monitoring and managing pre-existing conditions, okay, so such as diabetes. So keep superficial wounds clean, dry, move around, follow your doctor's instructions for managing your wounds, and take any antibiotics as prescribed. Now contact your doctor if you have any of the following, because it could be the start of something, okay? Intense, unexplained pain, swelling, redness, discharge, or foul odor. That's a good sign of infection. If you have a foul odors on a wound, it's a good sign of infection, because wounds, they don't normally have an odor to them, okay, unless they're infected. Fever, chills, sweats, once again, all signs of infection. So get a hold of your doctor so we can start you on either an antibiotic right away, anything to prevent the tunnels. So what's the outlook and healing time for a tunneling wound? So the tunneling wound treatments, it can be quite uncomfortable because you do need packing in that space, especially if it's a tight space. We have to keep it open and grow it from the bottom to the top. So it can be uncomfortable in that aspect. It can take weeks to even months to heal a tunneling wound. But with prompt treatment, these wounds have a faster and better outlook and are often less painful. So definitely time is of the essence when it comes to a tunneling wound. So I hope you found this information helpful for your daily practice and you know more now about tunneling wounds than you did before. So that's all I have for this video. I hope to see you guys in my next one. Bye guys.